Welcome to The Exam Room, the podcast where we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. I'm your host, Rhiannon Windsor, and we're charting the course through patient engagement. Let's scrub in and get started. We're continuing our conversation with Sonia about engaging Medicare beneficiaries. We're going to shift topics here and talk a little bit about empathy and trust. I have heard empathy defined as kind of getting down in the hole with someone and being there with them, right? As they're going through their stuff. How do you do that over the phone, though?
I think with empathy, you're letting that person know that you hear them, you understand what they're saying and how they're feeling, and maybe you can relate, maybe not me personally, but from a family member, what they're going through, or somebody I know, and validating their feelings about what's going on.
Yes.
So it's important that they know I'm here to support them in what it is that they're going through and how they're feeling about it. I know that a lot of times, even when they reach out to the medical field, people dismiss what the patient is feeling or how they're feeling about something. And we're not here to dismiss. We're here to assist. If they're feeling a certain way or they're receiving something a certain way, we have to understand that that's real for them. And we want to make sure that we help them through it.
It doesn't feel good to not be heard.
It does not.
So let's talk a little bit about trust. How do you start to build trust from that very first interaction?
So we know that the elderly population is scammed a lot in today's day and age. And I appreciate every beneficiary that I call and question whether or not I'm legit. I want them to do that. I want them to continue to do that. I don't want them to trust people right out of the chute because that's how people take advantage of them. So in order to legitimize our company and what it is that we're doing, I reassure them that I'm affiliated with Marana. I give them resources if they'd like to look things up, if they're capable of looking things up. I also give them options to call their health center to verify that we're legit. If they make the phone call to their health center, then they feel comfortable talking to somebody over there on validating that ABC Network is somebody that they can trust. If they don't have a way to do research or they're not interested in calling up their own health center or they're not engaged with their health center, then I can always mail them information so that they have it at their fingertips. My biggest concern, and I always let them know, is I don't want them to trust anyone right out of the chute. I want them to question everything so that they don't get taken advantage of. And so I don't take it personally. I just help educate them. And I will help educate them on what to watch out for. Because some of these scammers are just ridiculous. So we make them feel as comfortable as possible and answer every question that they have truthfully and honestly. I think by just being open and honest, friendly, I've been told I have an honest voice. I don't know that to be true, but I definitely let them know that I'm here to assist and that it's at no cost to them. I'm not going to be billing them. We're not going to be billing Medicare. When we're validating a phone call and verifying that we're talking to the person that we're supposed to be talking to, I don't berate them with the different questions to verify their identity. I do, however, verify the year that they were born. And later on in the conversation, I might verify the street address that we have listed for them. This way they feel comfortable answering simple questions. I'm not asking for their full date of birth. I'm not asking for their Medicare ID. To them, these things are very private. By not asking that information, I haven't automatically put them on edge or on alert. I've verified enough to talk about a little about their health care. They're giving me more information than I'm giving them. And so therefore I still, comply with the HIPAA rules and regulations. But this way they feel comfortable giving that information without me trying to drag it out of them.
Another thing I thought of is just doing what you say you're going to do.
Absolutely. If I tell them that I'm going to research something for them and get back to them, that's what I'm going to do. If I'm going to help them make an appointment or find them a podiatrist or find them their local bingo location, that's what I'm going to do. I'm not going to hound them. I will let them know. I'll give them a call back in a couple of days to see how they're feeling, etc. And then they start to look forward to our phone calls. They put us in their phone so it shows up on their caller ID, not to avoid our call, but to answer happily and call us by name, which I think is really great.
Do you ever ask them to put the number in their phone?
I do ask them to write it down and write down my name and the company name so that if there's ever a time where they need assistance, not to hesitate to call, and we will help them with whatever we can. And they're usually receptive to doing that. I've heard them say, well, I'm going to put it right here on the fridge so I don't lose it, etc. And by having them write it down and putting my name down, the next time I call and say, hi, it's Sonia with Arizona Best Care Network, I think they glance to the fridge and go, oh, that's that girl. And then it starts to put two and two together.
Yeah.
Right? Yeah.
So what if they ask you a question and you don't know the answer to it?
If I don't know the answer, I let them know I don't know the answer, but I'm going to find the answer. And the next time we talk, I will bring them back the answer. That I've got a team of healthcare professionals that will assist me in, finding the answer, which I think they're grateful for.
Would you say there's any certain phrases that you use or strategies that help patients feel more comfortable and at ease?
The only phrase that I think that I always use is when I have to leave voicemails. I always make sure I end the voicemail with, I hope you're feeling well today, so that they know that when I'm calling and leaving a message, it's just kind of a follow-up to a health-related matter. And that makes them feel a little more at ease, and my conversation or my voicemails don't seem robotic.
So continuing with that, just natural conversation, not scripted, not planned.
Absolutely. Never scripted. You can never plan these conversations. You never know where they're going to go. Letting it flow naturally, I think, is the most helpful thing with these conversations. There are some things that we really want to get out of the conversation, especially if we're starting to research what benefits they're entitled to. We might need to know if they're dual eligible, if they have the supplemental plan, who their specialists are, and where they're located at. But I'm not going to get that all in the first conversation. I don't expect to ever get everything I need in the first conversation. It's going to be over multiple conversations, and these conversations are not timed. They're as long as the patient wants to talk. If I start timing them, then it becomes robotic, and robotic doesn't help anybody. It has to be free-flowing. I have to have time to talk to these people as much as they want to talk and feel heard.
Yeah.
So.
It can't be like, well, I have 8 hours at work today and I have 20 people to call until I have to.
Absolutely. You have to allow them to flow naturally.
Yeah.
And they know when you're rushing them. They feel it. And I'll tell you, there are times where I start a conversation at 4 p.m. and I might still be talking to that patient at 6 p.m. And they start to say, oh, you were probably supposed to get off work at 5, weren't you? And I tell them it doesn't matter. I enjoy talking with them. And they love that. That's important to them.
Yeah, and these older folks, a lot of times they're lonely.
They are. Even when they have family around in the neighborhood or nearby, they don't have family with them 24/7. And so that phone call might be the only person they talk to all day long, which is important to them.
I know it's that way for my mom. She's retired, but my dad isn't. And so during the day, she's home by herself. Yeah, and she's like, all I have to talk to is the dogs.
And that's true. That's absolutely true.
So that just made me think about, I don't know if it's intuition, but being able to read someone.
Read the room when there's not a room.
Exactly. Because if you can't do that, then you're not going to start establishing, building that relationship, that trust if you don't have that, I would think.
I've noticed that sometimes it's just bad timing. You called at the worst time. They're futzing around in the kitchen and they just spilled a can of corn all over the floor and they're trying to clean it up, and then you call. You don't know that it's bad timing. So yeah, you kind of got to read the room when there's no room. Maybe try again. Don't try in 30 minutes like I've tried. Give it a day or two. Maybe give it a second person to give a call. But when you have somebody who is very closed off initially, it's going to take some effort to chip away at that wall and knock it down to where they'll talk to you. But you stay upbeat, you stay helpful, you stay honest, and you approach it each time with a smile on your face. And I think 99% of the time it works. Especially if they know that you're out there and you're trying. You're just there to help.
So then that is kind of a good segue into my next question, which is consistency. Consistency has to be there to build and, foster that trust, I would think.
Absolutely. Consistency will look like a lot of different things. I'm going to be consistent, and if I tell them I'm going to do something, I'm going to do something. If they need assistance, I'm going to follow through this time and next time and the next time. I'm not going to drop the ball once in a while, because that will lead them to distrust me and end our relationship. So we want to make certain that we're always being consistent and following through with what we say we're going to follow through with, and not leaving them in the lurch, because that's happened so many times before for some of these people. It's the little things. You'd be amazed at the little things that they're surprised somebody helped them with, because they might have left the hospital and the hospital said that they were going to look something up for them, and then the hospital never gets back to them. It falls through the cracks somehow. When you follow through and you provide them the information that they're looking for, whether it's, their local church or a knitting group that they could join, or a food service that might be able to come out to their home and drop off food. If you can get them that information, they feel like you've really come through for them. Mm-hmm. That's important, and it helps build the relationship up.
Thank you for joining us in The Exam Room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation on patient engagement was as insightful as your last checkup. A big thank you to our guest speaker, Sonia Sonato, for sharing her expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. I'm your host, Rhiannon Windsor. Until next time, take care, and thanks for listening to The Exam Room.